Hello everyone. So today we will be talking about gastrointestinal. So we have a 12-year-old boy presented to the office due to yellow discoloration of the eye, so it's jaundice. The patient first noticed the yellowing of the eye 3 months ago. There is no history of fever, abdominal pain, weight loss, or itching. Weight loss, so probably it's not something very serious, no malignancy, no fever, probably it's not some infection going on, no hepatitis. Vitally, the patient is stable. On examination, there is scleral icterus, and the rest of the examination is unremarkable. Lab tests show total bilirubin of 6 with conjugated of 4, which means it is a conjugated hyperbilirubinemia. Liver enzymes are normal, so LFTs are normal. Which of the following is the most likely diagnosis? So remember, liver enzymes are normal, so we can rule out things that would cause elevation of the liver enzyme, AST and ALT. Hepatitis ruled out because it will cause significant elevation in AST and ALT. This patient has normal. For the rest of the others, in order to rule out one by one, we need to talk a little bit about the metabolism of this bilirubin. So let's say we have this liver here, and this liver is represented by this letter H. In the liver, so we have the red cells here, out here in the periphery, in the blood, and they are normally undergo breakdown after 120 days. For example, the life of the red blood cells is around 120 days. After that, they may break down. But there are conditions where actually hemolysis occur, where the red cells are not old, but they're hemolyzed because of pathology. For now, just know, once the red cell is broken down, it releases unconjugated bilirubin. The hemoglobin is converted into unconjugated bilirubin. Now, this unconjugated bilirubin is going to go into the liver cell. Unconjugated bilirubin is then converted into conjugated bilirubin by something called UDP glucuronidase transferase. UDP glucuronidase transferase. Now, let's talk about which of the conditions will decrease the level or the activity of this UDP glucuronidase enzyme. It includes, one is Gilbert, the other is Crigler-Najjar. So Gilbert syndrome causes mildly decreased UDP glucuronidase activity. UDP glucuronidase transferase activity. So it is going to cause unconjugated hyperbilirubinemia, but the thing is, it is going to be very mild, and it's going to be mild conjugated, not it's going to be mild unconjugated, not conjugated hyperbilirubinemia. This is conjugated in this patient. This patient is conjugated. First of all, it is ruled out. But remember, Gilbert unconjugated hyperbilirubinemia, it's going to be mild, and it's going to be in stressful situations like running a marathon, like fasting. So those conditions, but asymptomatic, don't need to treat it. Next is Crigler-Najjar syndrome, very severe deficiency, almost to the level of absent UDP glucuronidase transferase activity. Very severe, but it's not going to be conjugated. It is unconjugated hyperbilirubinemia. So this is ruled out because here they are saying conjugated. Very severe, you need phototherapy for it. You need even a the exchange transfusion for it. So very severe condition this. Then Dubin-Johnson. So this um, conjugated bilirubin is then transported on the hepatocyte into the bile. So this is the bile duct. Now, once this is in the bile duct, it is obviously excreted out at the level of the duodenum. So, but if this transporter is defective, conjugated bilirubin cannot escape into the bile. So what happens? Their levels start to build up. You get conjugated hyperbilirubinemia. Dubin-Johnson, right answer. Because this patient has conjugated. This makes sense. Now let's talk about the last option, and that is hemolytic uremic syndrome. Hemolytic uremic syndrome can occur in someone who is 12-year-old, usually occur at a younger age, like 12-year-old, 9-year-olds. They eat a hamburger, then they have a bloody diarrhea, and then they have hemolysis and creatinine elevation. This patient has none of those. This patient purely just has jaundice. No hamburger history, no bloody diarrhea history, no creatinine elevation. Wrong answer. Now let's talk about what can occur in hemolytic anemia, which type of jaundice. So remember, when you have hemolysis, like this is the red cell, and it is getting absolutely thrashed in hemolysis. The unconjugated bilirubin is raised. Now it is going to overwhelm the activity of UTP glucuronidase transferase. It cannot convert that many unconjugated bilirubin into conjugated bilirubin. What happens? It starts to rise. So it's going to be unconjugated hyperbilirubinemia rather than conjugated. Hemolytic uremic syndrome, wrong answer. The final right answer is Dubin-Johnson. Thank you so much for watching, and if anyone is interested in tutoring, they can email here to us at TopMD, and thank you for watching.